You're watching the BU Start Now podcast with Sanartina. This is your host, Sarah Ashley Neal. Our guest today is a consultant obstetrician and gynaecologist. Trained as a medical doctor in the UK, she joins us today to talk all things menopause. After working with the NHS as a lead consultant, she has since moved to Abu Dhabi in the Emirates. Looking after patients in their city hospitals for over 5 years, she now shares part of her own personal journey, dispelling some of the myths around HRT. A passion for helping women better understand their bodies and emotions throughout their journey towards and through menopause. Known for her warmth and sincerity, let me introduce you to Dr Bindiya Jhamb. So welcome to the show, Dr Bindiya Jhamb.
Thank you, Sarah. Lovely to be on your show. It's an honor. So how have you been?
I'm all right, thank you very much. Is it okay if I call you Bindi? Because we've known each other for a few years.
Yes.
Where did we meet? Nottingham?
Yeah, Nottingham, of course. 5 Cloverlands.
You can tell people that now because you don't live there. So we're safe.
Absolutely. Whoever lives there now.
So what's going on with you? So you've come to the show and we're going to be talking about menopause, and I don't know why I'm gone blank.
It's a part of being menopausal.
Yeah, I might put that one in the trailer. I might put that in the trailer. No, but it's silly because I think it's because it's you, because I'm so excited to interview you. So Bindi, you're in Abu Dhabi.
Yeah.
Is that how I pronounced that correctly?
Absolutely, yes, Sarah. I am in Abu Dhabi at the moment. I've been here for 6 years now.
6 years? Where's that time gone?
You tell me. In 2016, I came to UAE only for 6 months, and it ended up in 6 years.
6 years. Yes, I remember, because you were saying I'm going to go there and I may only be there 12 months. And here we are now, 6 years later, doing a podcast together. It's quite surreal, really, isn't it?
It is, yes. I've been looking forward for this.
So you trained as a doctor. Can you tell us, the listeners, a little bit about your background?
So I trained in the UK in Wessex Deanery, which includes Portsmouth, Southampton, Dorchester, the countryside of England. I was there for 7 years undergoing a training. Then I moved to Manchester for a bit as a locum consultant in obstetrician and gynecology. And then I was finally in Nottingham, and that's where we met. Yes.
And now you're all the way in Abu Dhabi.
Yeah, which is only 6 hours flight away. So
you like it there? You're enjoying it?
Yeah, so far so good. Yes, I enjoy even the summer season when I don't have to go out. But it's a beautiful country. It's multicultural. A lot to learn from, really, here.
And was it quite a change for you in dynamics, the way you're actually working with your patients?
Yes, that is actually, that I would say is almost a 180-degree turn. So as you know, in the UK, we are more into the NHS. We rarely get to see the same patient again. Whereas in Abu Dhabi, where the 2 hospitals that I worked in over the last 6 years, I recognize that you're closer to your patient in terms of a continuity of care. You can see the same patient, if you wish, several times. And that's a good bonding between the patient and the doctor. And in Abu Dhabi, I am doing obstetrics as well, which means I'm delivering babies as well. So you can imagine walking the journey with your patient for 9 months. There is a strong bond with your patient here.
Absolutely.
Yeah.
I was going to mention about obs and gynae, which obviously it gets shortened down to. And there may well be men listening to this podcast alongside women. And sometimes it's a terminology. So I think you've said about obs. We say obs and gynae, but even I used to think, well, what does obs actually mean? Can you tell us again what they mean,
sure,
obs and gynae?
Sure. So, Sarah, many times I've been asked by people, what is your job? If I say I'm a doctor, they wonder. Then their next question is, what doctor are you? And I have to almost, pause for a bit and then make it simple for people who are not doctors, which is, I deal with women's health and delivering babies. So that makes it simple for them. So when it comes to women's health, it's pretty much anything under the earth. I could be dealing with fibroids, cysts on the ovaries, all sorts of causes of pain in the pelvis, I even deal with the cosmetic side of things down below for women. And
Hmm.
this is in addition to looking after women who are pregnant. I walk the journey with them all the, I would say, 40 weeks of pregnancy. So that part is classified as obstetrics, which deals
Right.
with dealing with pregnant women and delivering them. And anything outside that is gynecology, which I say is women's health.
Right. That's cleared it up for me as well, to be honest, because I think even from a woman's perspective, we don't know everything about our body. We don't necessarily know how it all works, and we go through our cycles, and then we start noticing things are changing in our body. And just because we're a woman, it doesn't mean we know how we function inside. And actually, I mean, it's like running a, I say running a car. All the women out there, I'm not saying we're cars or automotives, but we know some of the basics, but we don't know all the ins and outs. And often it's when something goes wrong that we actually seek advice or support. And in the case of the topic we're talking about today, perimenopause and menopause, which I know you're really passionate about, it's going to be a bit of an eye opener, and to hear it from an expert like yourself, a doctor. So I think we'll just crack on and talk about these two other terms, perimenopause and menopause, because I know myself. I listen to people, even as a therapist. I hear people saying, "Oh, I'm going through menopause," but are they going through menopause or are they going through perimenopause? Would you like to talk to us about those two terms, please?
Sure, of course, Sarah. So, yes, you're absolutely right. Having walked the journey myself, I'm very passionate to understand menopause and perimenopause. And it is an opportunity through your podcast to spread awareness of it and women as well.
Mm-hmm.
You will be surprised, really, that even before I explain what is perimenopause and menopause, 77% women do not recognize that the symptoms they're having is because of menopause. Now, to make it simple, menopause means that the woman has had her last menstrual period 12 calendar months ago.
Right.
Whereas perimenopause, as it says on the tin, it's around it. So, average age of menopause in the UK is 51 years. So, you can say between the age of 45 and 55, um, the woman is perimenopausal. In During that course of time, really, she could be having some spotting, and when I say spotting, some sort of a vaginal bleeding, not a
Mm-hmm.
full blown period. She could have a full blown period which is very erratic, so her cycles could be erratic, they could be very painful, or she could even have regular periods, but around the age between 45 years and 55 years is really perimenopause. And I would like
Okay.
to take the opportunity here to mention there's something called as premature ovarian failure. And it's 1% women who unfortunately may have it. So, what that means is before the age of 40 years, some women may stop their periods completely. And I would not say early menopause, I will say it's a premature ovarian failure.
Okay.
And then the question goes on to what is early menopause? So, early menopause is when the woman stops her periods completely, again for 12 calendar months before the age of 45. So, to keep it simple, 45 to 55 is perimenopause. At any age, 40 years onwards, if the woman doesn't have her periods for 12 calendar months, she's gone into a menopause. If that happens before the age of 45, it's early menopause. If that happens before the age of 40, it's premature ovarian failure. So I'm
Goodness
hoping I've
me.
made it clear for my listeners.
No, thank you for that, because I think a lot of the time, as we begin to get older, and like you've just said, you can go into menopause at an early stage, and also some people may have a hysterectomy when they're younger, might which and that throws them into to menopause immediately. Is that right?
So, Sarah, yes, that's a very interesting point you brought up. So, if a woman, for whatever the reason, maybe because of the cancer or maybe because of, let's say, a big fibroid, they've ended
Hmm.
up having a hysterectomy, but the ovaries are left behind. Yes, within a few years down the lane, actually, technically speaking, they go into menopause straight away. But because the
Right.
ovaries are there, because they stop their periods, the minute a
Hmm.
woman has had a hysterectomy, technically she will not have the next period. However, since the ovaries, which we generally tend to keep behind if there's no other problem in the ovaries still continue to function. So when I say what they
Hmm.
continue to function is they give out our favorite hormones, the estrogen, the progesterones, and a bit of a testosterone as well.
Right.
And for a few years, they keep us going. But because there is no target organ, i.e., there's no uterus for the ovaries to work on, gradually the ovaries, they begin to retire, as they say. And many patients, they wonder what is retiring. They gradually begin to shrink and they give up their job completely of making the hormones.
It's absolutely amazing, isn't it, how the body works? When you touched on earlier about the sort of age, 51, I know that in some of the work that you do, you talk about even the history of menopause and how, our life expectancy is longer now than it was years ago. But the figures don't show that anyone went into earlier menopause because they didn't live as longer. So this has been going on for what, thousands of years. I mean, this cycle. I mean, there's no other evolution going on.
So yes, this is interesting. Ever since woman stepped her, it's like since the time of Adam and Eve, you can say, the women a woman is known to, go into a menopause. It is a default. 100% women at some stage in their life will get into a menopause. But what is very interesting is, as you rightly said, that our life expectancy has changed.
Hmm.
Unfortunately, what that means for us is, given the life expectancy increasing to almost in the 80s, about 30 odd years for a woman is spent in her menopause. And my passion comes from there, that we see more and more women in the workforce, in the community, who are past the age of 40, who are exposed to menopause. And that's why I feel that I would like to be a patient ambassador, and as a doctor, and being on the other side of the fence to, educate people that menopause is not a disease. It is a natural transition. But it doesn't mean that you have to suffer. There is a lot you can do about it. And that's what, I keep telling my patients in my clinic, that good, you're coming to me. There's a lot out there which I can help you with.
And the word, I had that question at the back of my mind. It isn't a disease. It's something extremely natural. And I know you talk of menopause as a priority. Uh, what do you mean by that? It comes up in some of your conferences and your literature. Menopause as a priority.
So, why I say menopause is a priority, because earlier, less life expectancy of a woman means she's exposed less to menopause stage. And the priority now is, as you may see, Sarah, around you, and many women, they're getting into a relationship late, or they're getting married late, which means that they are going to start their family late. And
Hmm.
let's say, what I notice in my experience, and more I encounter in my day to day practice, is that women are carrying on with their high profile career till the age of 40, 41, and then they come to me and they want help with making them pregnant. What that means is, really, if they're going to go into menopause by the age of 45, let's say, because 45 to
Hmm.
55, as I alluded to earlier, is a perimenopausal phase. It just means that we need to pay more attention to their needs so they can look after their young children, or some of them may have teenage children, they may have
Hmm.
elderly parents to look after, while all the time with all this they have to focus on a highly stressful career as well.
That all makes sense. And again, are there symptoms of post menopause? Because I know, even talking to my mum, when she was in her 60s and 70s and she was on HRT, and I haven't chosen to go that path, um, she still gets hot flushes. Now, that could be because of other conditions, and certainly I know, talking to women, which is why it's about awareness, that women think as soon as I hit the menopause, it's all plain sailing. And it's not to scare people or to have the listeners think, oh gosh, I've had 10 years before menopause and now I've got another 10 years afterwards of symptoms. But are there symptoms to deal with after hitting that 12-month period?
So, some women, I would say only a handful of women, or you can say 25% of women are lucky that, boom, period's finished. That's it. They don't feel
Mm-hmm.
anything like hot flushes or night sweats or irritability or anxiety or any sleep disturbances. But 75% women, they do experience some symptoms. And as you said, that like with your mom, my mom too, hot flushes, night sweats, waking up in the middle of the night, although if the fans
Mm-hmm.
are on, the aircon is on, just feeling miserable with the sweat. So that is one of the most common symptoms. But what is very interesting is that even if women are suffering, they do not know that there is help out there. They can do something about it. That is what is a bit frustrating, really. But in addition to the hot flushes and the night sweats, as I mentioned earlier, the estrogen hormone, which is the most important hormone for a female, it tends to go haywire. It becomes very chaotic in the body towards the menopause, or even in perimenopause bracket. And
Mm-hmm.
what that means is, because estrogen is present everywhere in our body, in the brain, skin, heart, bones, of course, the uterus and the ovaries. So it can affect anything. Like many women, they complain of a brain fog. They cannot focus at work. And
Mm-hmm.
more and more women who are in their 40s and their 50s, they're doing such important jobs like being a CEO or being a pilot, and they need to concentrate. And these are
Yeah.
some of the short term, you can say some of the commonly known, but there are long term consequences as well of menopause.
Thank you for that, Bindi, because we can touch on some of the symptoms again and maybe talk about some experiences and case studies between us. Um, but just coming back before we do, onto the fact that some of our listeners may well be men. I hope they are, because if the perimenopause is starting early, and we don't, not every woman will notice the symptoms or have all the symptoms. I think it's a reminder to say that yes, there is a common list of symptoms. um, Not everybody is going to experience the same levels and the same degrees. And I know a friend of mine who said, I don't know what all the fuss is about, and she's female, who because she didn't go through half of these symptoms. And if somebody has experienced them at a younger age, and like you said, with you've got the families, whether you work or you don't work, it's an eye opener for the partners, the spouses, the friends, and family to be aware of some of those symptoms, because there's a lot of stigma that can be attached to these. And even if you've got teenage children at home, it's not about the case of in the old days it was mummy's or mum, maybe not mummy if you're a teenager, but mum's going through something at the moment. It's now about having more honest conversations and open conversations. So like you said, it's not a disease, it's something that happens to all women, but not necessarily all women experience those symptoms. So can we touch on some of the symptoms a little bit more in relation to how it can emotionally and psychologically affect a woman?
So, as Sarah, you said, I am also hoping that there are men folk who are listening to this podcast, because I often do hear and hear from the men counterpart. Oh, she gets very moody and irritable. I'm on my guard. She may just murder me someday. No, I just want to tell them it's not because your partner is having a bad day. It's not that. It is the hormones make you feel that way. The hormones keep going up and down in the body, and that is what is reflected as, sometimes feeling very psychologically vulnerable, feeling very anxious, feeling moody. Often, women in their menopause, unfortunately, don't get a good night's sleep as well. They have a lot of sleep issues. And we will appreciate, of course, that a good night's sleep is very important to function the following day. And it could be with anybody. It could be a woman who's
Hmm.
not menopausal and she has not had a good sleep. She is bound to be irritable. Now, it gets many-fold exaggerated if the woman is a menopausal woman and she's not being able to sleep because of the
Hmm.
hormone chaos in her body. So I do want the men folk to, support their partners in this. It's like a support itself. So if you're psychologically supporting your partner who's going through all these mood changes, anxiety, depression, it may alleviate the symptoms.
Mm, absolutely. No, thank you for that, Bindi. Can we talk about, or are you able to give some examples of different types of case studies that you may have come across to illustrate the differences between how we experience the symptoms? Again, not to scare our listeners, but to illustrate that some people who do have all the symptoms, um, it can really impact on their life. Have you come across anybody who, quote unquote, feels that they are suffering dreadfully with a menopause and not getting that kind of support or feeling understood?
Yes, of course. Many times in my clinic, and especially while I've been a healthcare consultant in Abu Dhabi, I recognized more and more the need of women to be acknowledged. I can still recall, I had a patient who has now moved back to the US, but she was one of my Western expat patients who said, Dr. Bindi, could you help me with what is called hot flushes and night sweats? And she had done so much reading about it. And she did mention it's as if she's drenched in sweat. She wakes up as if somebody has poured water over it. And counseling, understanding. So the first thing that I realized, that me spending time with her to understand what she is going through helped her a
Mhm.
lot in that. Even when you hear your women out, you hear your clients, your patients out, that itself helps them a lot. And yes, I've had patients who said they felt like, one patient very recently said it's like a volcano that's erupting and the lava is coming out of her. She did leave an indelible mark, and while she was talking to me in my clinic, she literally had to take off her cardi. And my clinic, I would say, is freezing cold with the aircon almost at 16 degrees. So you can imagine. And
Mhm.
some women have even said they've lost themselves. They said they don't know who they are anymore. These are some of
Yes.
the, they say they don't know. They're not the same person anymore. Somebody's taken the life out of them. So these are some of the case scenarios, and they have really prompted me to, get more and more understanding of menopause, really.
And it's the word compassion comes to mind because it's not always, we don't always have that. I mean, they talk about bedside manner, don't they, in the medical industry?
Yeah.
And I was thinking early, something completely separate. I'd rather someone knows their job, and if I had an operation, I'd like it to be done by somebody who knows what they're doing. Forget the bedside manner, but actually, I think it comes into it, and especially in something so personal because of the stigma. I think it's getting better, and I know a lot of people out there, professionals who are and coaches who are supporting people and around menopause to help remove that stigma, the social stigma and the self stigma. And as I said, talking about how women are in the workplace is a separate topic in itself, but it's which I know we haven't got time to cover every aspect of it today. But from my experience, I've come through menopause, and I didn't have a lot of the symptoms, but the ones I had felt quite devastating at times because we talk about hot flushes or flashes. I know the listeners probably heard different terminology, and I sort of I knew I was going through perimenopause, and I went through that for a while. But the two areas that I find come up a lot when I talk to people are the flushes and flashes, and the feeling that I need to go and get checked out for dementia. Quite literally, feeling that something isn't right, and yes, the brain fog. And I would wake up 30 times plus a night with the hot flushes, and I'd have a cold hot water bottle. I'd have ice in the fridge, and this could be in the middle of winter, and it
Wow.
disturbed my sleep pattern. Now I would say, it's reduced now, and I can still be awake sort of 10, 12 times a night. And I think what you were talking about affecting your sleep, you then get into a habit and a pattern. So even though people are having perimenopausal symptoms, they go through menopause. It's that aftermath. You're sort of still wanting to give yourself that self-care, that self-love and a respect for what your body has gone through.
Absolutely. Yeah.
And you're at hand to support people even post-menopause.
Of course, yeah. And what is interesting, Sarah, it's good we are sharing our experiences.
I want to today to make it honest for our
Yes,
listeners.
and this is where I would believe my patients will understand, other women will understand once we share our experiences. Um, Interestingly, and on the contrary, I've had what is called a surgically induced menopause.
Okay.
And that started in 2018. So, following my hysterectomy, I would say a couple of years later, I was quite taken aback by the severe joint pain that I started with. And you would think that, oh, it's a joint pain. And I visited all the possible orthopedics, and of course, lots of calcium, lots of vitamin D's, lots of painkillers. But what I recognized is, and I did my own reading up to identify why the joint pains are so, they were really crumbling me, you could put it this way. I was
Mm-hmm.
going to work,
Mm-hmm.
yes, I was not using any support, but it was really getting to me to reach to the bottom of the cause. And then I did my own diagnosis, you can say.
Mm-hmm.
It's nothing but because of the hormones getting depleted following a surgically induced menopause. And you can see the variation in the symptoms. Um, some women may not have any joint pains, and joint pain, it could be a knee pain, it could be a foot pain, it could be a back pain, it could even be a
Mm-hmm.
pain in the elbow, anything is
Mm-hmm.
possible. And it just goes on to show that um, women can suffer in different ways as a result of menopause. And it's very important to make them understand they're not there alone. We need to develop support groups. And I know that in the UK and even now in the UAE, there is a big drive for having special clinics, which is called
Mm-hmm.
as the menopausal clinic, so that women know that there is a place that they can go to and discuss, because it needs a lot of counseling.
Mm-hmm.
You can't just say, oh, yes, I have menopause, and yes, these are the medications, go home, do them. No, this is not the way. You may need to end up more time with them and repeated follow-ups.
Mm-hmm.
In fact, that does remind me. I had a patient who said, Dr. Bindiya, I don't know whether I've come to the right person, but she was having recurrent urinary tract infections, or water infection, you could say.
Mm-hmm.
And when I went down the history, yes, menopause can lead to recurrent urinary tract infections as well, um, which often women think, oh, it's they have some problem with their bladder, that's why.
Mm-hmm.
So the problem in the bladder could be because they need a support with some hormones to make the skin more more robust.
Because the linings do get thinner, don't they? Because
Yes.
and when you mentioned about, which is quite interesting, when people think of estrogen, it's often they think of it, um, in the female reproductive system, and they don't think of it in the brain and the heart, as you've mentioned, and how estrogen is vital. Very useful, I must say, because our body changes once the estrogen gets reduced, doesn't it? And that nicely sort of moves into the topic of where it's not just about the practical side of menopause. Um, when I say practical to the listeners, I'm talking about the functional side of how our body functions, how our body operates. We've touched on sort of the emotional side, but life does change, or it can change. I know one has to be careful of saying, I'm going to hit menopause, so I'm going to feel this way. Life is going to be downhill. No, not necessarily. It's mindset. And again, I think that's another podcast altogether. But definitely about they begin to notice their body changes, and they may have to exercise in a different way. Maybe they have to change some of their eating habits, and it's not, they cannot necessarily do what they used to do 10, 20 years ago. And I think it's same for men. Our bodies change, but we've just got slightly different organs, haven't we, on the go there. So what are your thoughts about how people can help themselves to cope better with their own body changes and lifestyle changes?
Yeah. So, Sarah, that is very good that you have already recognized that, yes, there's a need for simple things. So, whenever a woman is menopausal, always start with simple things. It's doable with less side effects. So, as you correctly said, the type of exercise makes a difference. And there is medical evidence out there which talks a lot about swimming. So, swimming about
Mm-hmm.
2 to 3 times in a week and about 30 to 40 minutes, it's not only burning your calories, it's also
Mm-hmm.
good for the joints. It's going to give you, it releases so-called happy hormones or endorphins. It helps in
Mm-hmm.
de-stressing. It's an anxiolytic. If like I've had several patients in my clinic, they said, "Oh, I didn't know swimming can do all that. I love
Mm-hmm.
swimming." I said, "There you go. Go for it. Pick it up as your hobby again, and it's going to sort you out in a big way with all these, symptoms and feeling very de-stressed. Put it this way." Um,
Yeah.
yeah. And in addition to swimming, eating habits have to change. See, I know people say age is a number. Yeah. I
Mm-hmm.
have a little different take on that.
Okay.
Age is not just a number. And why I say it, a woman at the age of 25 will have a higher metabolism. Yeah.
Mm-hmm.
A woman at the age of 55 will not have that high metabolism. And why do you think we say lifestyle advice?
Mm-hmm.
Lifestyle modifications itself says age is not a number. They tell us to have more of antioxidants. They tell us to have more of, less carbs and, less of processed food, less of the sugars. So there's a reason behind it, that it
Mm-hmm.
helps to, that's why they say fresh fruits, fresh vegetables, like healthy food, more of proteins, more of estrogen rich food. And
Yeah.
you could ask me then, what are the estrogen rich foods? It's like soya, chickpeas. It is important, particularly in menopausal women.
Mm-hmm.
And in addition to the food, the exercise, they say yoga and meditation really helps. There is medical evidence
Absolutely.
behind it. It's not just to calm your nerves down, it just helps you with
Mm-hmm.
everything.
And this is it. There is science out there. Meditation and yoga has been going for thousands of years, but it's now that even neurologists and scientists are really, doing some real good evidence-based research. Not that, I mean, I'm not the best with statistics and talking about going down that side of things with the science, but I certainly practice it and I know the benefits myself, and I can impart that knowledge to other people because I come from a perspective of being holistic, which I know you do, holistic
Yeah.
practice, and if medicine's going that way, and if people can even think about living a holistic lifestyle or approaching their well-being more holistically as early as they can in life, so that when they get towards menopause and through menopause and out the other side and well into the 60s, 70s, because people are living longer, if they're
Absolutely.
mindful of getting to know their body better at an earlier age, so they can identify not only through menopause, but some of the changes that are going on in the body, maybe through an illness or a temporary or ongoing challenge, mentally or physically, and just begin to have that awareness where they can adjust their own diet, which can change from day to day. We all know we have days where we just feel off color and we
Yeah.
get back on track. But if we can in the background always just be a little bit more aware of our
Yes.
state of well-being and take ownership of that, and I think that's something that I feel it's something I'm passionate about, because I've always said, and I say it on most podcasts at the moment, we can go out and get support, but we still need to help ourselves in first instance to identify, because it's our body, it's our mind. And if we're not sure, we go to people like yourself, whether it's a doctor, always see a health specialist, I say. We haven't got all the answers because we're not medically trained, but we do know our bodies.
Now, you said that very beautifully, Sarah. And knowing you, your healthy lifestyle, and you trying to, it's very good that you're sending this message out. It is nothing but holistic approach at making the woman realize that yes, you're not there alone. That you do have a problem. It's not that you want to just say no, it's all in the head. No, it's not in the head. These are all medically proven situations and scenarios.
No, thank you. No, thank you for that. Appreciate that because it's good feedback. There's something I wanted to ask you about. We've sort of touched on it, but in terms of misdiagnosis, now I don't want to go too in depth down the medical route today, but again, the more we're having these open conversations, the more people start, Googling their doctors online, or there's a name for it, isn't it? I can't remember. I should know it. It's on the top of my head.
Google.
Dr. Google. And also there's a term, isn't there, for for people who literally, I've got this symptom, I've got that symptom, they go straight online and then they tell everyone, I've got this or I've got that. And there's one thing being self-aware and also being
hypochondriac,
trying to make symptoms actually fit. But at the same time, there's a lot of knowledge out there on the internet, isn't there? And I think it's again about being responsible and making an informed decision. And maybe you're going to maybe Google initially. I say Google, it could be on any search engine, and you might think those symptoms keep coming up, but then see a health practitioner or a doctor to get that diagnosed or validated. But sorry, coming back to misdiagnosis, you look at underlying causes and conditions, you'll see, in the world of medicine course. Anyway, don't you? Yeah. But someone will come to you possibly and it won't be anything to do with menopause or the other way around.
Yeah. So that does remind me of a case where a patient, a lady, came to me, 56 years of age, and she said she feels nauseous and bloated all the time. That was her only symptom. So obviously, there are lots of conditions out there. As you said earlier, when you can't concentrate, you tend to forget things. It could be dementia. It could be an early onset of Alzheimer's. Or, you can't just label them. You have to go through all the steps and get what I say is a multidisciplinary team input. So get the neurologist in, get all the relevant specialities in. Now, this example I'll go back to, she was having nausea and bloatedness all the time. That was a symptom. I got her checked with the endocrinologist. I got her checked with the gastroenterologist who deals exclusively with this. So what I'm coming to really is sometimes the symptoms of menopause can be very vague. And to avoid a misdiagnosis, it's important that you involve all the relevant specialities. And once they have checked that there's no pathology in the body, there is, so to make it simple for my listeners, that there is no known other problem in the body, then we can say, okay, well, then we can put the blame on menopausal status. So this is very important. But there have been cases, for example, many menopausal women, they say they are always getting aches and pains. So they get labeled as fibromyalgia. We need to have a broader horizon and not be tunnel visioned here. But yes, it can happen. Yep. And of course, we know in medical industry, many symptoms overlap of the conditions. But the good thing these days is that we have too many specialities out there and we can take input from all of them and make a correct diagnosis.
Excellent. So Bindi, you work with wellness clinics and well woman clinics, is that what they're called?
Yeah, so basically what I have, having recognized the need for giving special attention and special time and more time to understand my patients in the menopausal phase of their life, I am in the process of establishing what is called as well woman clinics in the hospital where I'm working currently. And what that means is basically, I want to give that leverage to patients in the menopausal phase, that they have somewhere to go to. Yeah.
Mm-hmm.
Where
Mm-hmm.
they can be heard, they can be counseled, they can be, a treatment, a variety of treatment options can be offered to them. Now, I know that in the NHS, they have something like this already. There are certain consultant colleagues of mine, and with a special interest in menopause, and they have been trying to establish the same in the NHS. But one thing that differs is, of course, in the NHS, to reach to the consultant, they have to go through the primary healthcare system. And in
Yes.
case the GP that the woman visits does not have a special interest in menopause, that can take a bit longer. So, what really I'm
Mm-hmm.
coming to is, these women, we need to address their needs sooner rather than later. And being in the UAE, given the opportunity, I feel that we can address their concerns sooner rather than later.
That absolutely makes sense. I think it ties in nicely what we were talking about earlier about being able to have that holistic approach and have that self awareness so that we can go and tap into those resources earlier
Absolutely.
on
Earlier.
rather than later. Yeah.
Yeah,
Um, I appreciate time's getting on. Are you okay for just a couple more minutes,
yeah,
or
sure, sure.
yeah,
Absolutely.
okay? I was wondering if we can maybe dispel some of the myths. I know this is again in itself a big topic. Are there uh, any particular myths that you'd like to dispel in this particular podcast today?
Yes, as you said, Sarah, that's right. There can be another podcast on in itself, regarding the multi, what should I say, the $1 million busting of the myth of, is HRT safe? Yeah,
Yes.
we've been hearing it since 2002. We've had big study called the WISE study, and unfortunately, when the study started, though it recruited almost 40,000 women, and this has been the largest study of its kind. Unfortunately, the
Okay.
data got leaked out to the press overnight, and they had to stop the study. And would you believe it, 18 years down the road, the same study had its follow up. So the study which declared in 2002 had to be prematurely stopped, that HRT is dangerous. This is how it was labeled.
Right.
The follow up of the same study says that no, HRT on the contrary helps. And my take on this is, um,
Mhm.
HRT is not dangerous. All it needs is a careful assessment of the woman. Yeah.
Mhm.
Don't just say it's a hormone, it's bad. No, one can die of a heart attack more easily. One can die more easily in a road traffic accident. It is not as harmful to take HRT. It's a risk benefit analysis, like with
Mhm.
everything. Yeah.
Mhm.
It needs a careful discussion with the patient, risk calculation, and then I am a firm believer of giving hormone replacement therapy. It's said it's the right tool in the right hand that it can help, really.
I did mention that I didn't go into the HRT route, didn't go down that route. Now, in hindsight, sometimes now I've been through quite a few of those symptoms, not all of them, but clearly some, as I said, some difficult ones impacted my life. Uh, I can sometimes I do sit there and I think, oh, maybe you should have tried it. What would it have been like to have tried it? And I'm never going to know. But there comes a point where, again, you can only answer this so much today. But can you, once you've come through menopause, HRT is not an option, is it anymore? Is that right? Would that be the
So,
right thing to say?
so what I would say is, HRT is, you can take it at any stage of menopause. There are different
Okay.
ways of taking HRT. The most important question that you have to ask is, why are you taking HRT? So
Yes.
I'm going to give in my example. And as I said, that HRT can be available in the form of its several forms, just to make it simple. It can be estrogen only, it can be a combination of estrogen and a progesterone, and we can, like icing on the cake, a testosterone on the top. Um,
Hmm.
but it's not only the tablets, it can be in the form of a tiny device inside the womb, or transdermal patches. Transdermal
Okay. Hmm.
patches have got the least side effects. So I would like to throw in my example here, that The main symptom that I had was a joint pain, and the use of a transdermal estrogen patch is proving to be very, very helpful.
Right.
Yes,
Okay.
so it's important. I would want my listeners to know that it is not dangerous. In fact, estrogen is an anti-inflammatory. Some of my patients who asked me in the clinic, they said, "Oh, it's dangerous for I'll get cancer breast." I said, "No. On the contrary, it can decrease the effect of it." Again, there has to be a risk assessment.
Yes.
Cardiovascular system. In fact, not taking estrogen can have devastating impact on the heart system and can also increase the mortality of the woman. Estrogen, particularly, has got a
Hmm.
good effect on the heart as well, and it increases the longevity of the life, as you would like to hear that.
That's really interesting to hear, because again, we're talking about myths and hearsay, and I think it does come down to, for health disclaimer here on the show, but it does come down to obviously talking to a professional, because if your friend's on something, great, go to your own doctor and talk about it and see if it's suitable for you, because it may or may not be. But I think it's good that a lot of these conversations are happening, even if if all the doctors were flies on the wall, as they say, they might be thinking, "Oh, they've got this wrong, they've got that wrong." But the fact that people are having the conversations in the first place, I just think is so healthy. And I think that the takeaway I'm getting from this is that everybody is very different. Equally, you can hear of someone who had a bad experience, and we know that can stick in the head, and we'd be thinking, "Oh, I'm not going to take that because one person out of 100 had a problem, or one person out of a million had a problem." What would your takeaway be on this particular topic that we're talking about today? They could be struggling, they could be feeling confused because of the amount of information out there. I mean, where do they start? I mean, do they go to their doctor first? Do they go to the internet first? What would you say from a
Yeah.
professional point of view?
So, Sarah, my take-home message from this, at the end of it, it's menopause is inevitable for every woman, sooner or later. Don't feel you're out there alone. Identify a doctor or a healthcare professional who is specialized and has a passion to discuss and treat
Hmm.
patients, or women, I would say, not patients, women in the menopausal phase. And it's very, very important to hang in there. It's not going to be a quick fix. It's not going
Hmm.
to be one size fits all. And it's of course, we can't stay away from in this world of internet, we can't stay away from using different search engines, but take it with a pinch of salt and rely on the professional, really. And one size does not fit
Hmm.
all. What medication or what advice could have worked for one may not work
Hmm.
for the other. So it's important we take all this together and take it from there.
No, that is excellent professional advice there. Anything else you feel that you'd like the listeners to know that I haven't invited you to discuss today? Is there anything particular in this podcast?
You've covered it all, Sarah. It has been it's really been an opportunity for the two of us to spread the awareness, across the globe
Wonderful.
about
Thank you ever so much.
inevitable transition in life.
And there aren't any quick fixes, are there, necessarily? And I think that's maybe we'll have a chat one day about mindset around this,
Yes.
because I know it's and that's where we move into the holistic arena, as it were. But Dr Bindiya Jhamb, thank you ever so much for coming on to my show today, and I'd love to have you back on and explore some more topics
Thank
in
you.
the
Thank you
obs and
very much,
gynae world.
Sarah. No, thank you very much. It's been a pleasure to be on your show.
Thank you very much. Okay, well, take care of yourself.
You
Thank you.
too. Bye.
Bye. Bye. Well, if you'd like to learn more about Dr. Bindiya Jhamb and her work, she can be found on LinkedIn and Facebook. So we'll put some links into the show notes below. And remember, our show is about helping you to create healthier habits in the life you live now, until new lifestyle practices change how you live your life. Well, that's it for today's episode. Thank you so much for watching and taking time out to join us. If you enjoyed the show, it would be really great if you could leave a review, and I look forward to welcoming you back to the show next week. This has been your host, Sarah Ashley Neal.